right? So let's get into step-by-step now. And this is where we'll start breaking down a little bit. We'll start talking about specific examples. I'll stop the presentation phase and we'll get full screen, and I'll show you some different stuff. So if you are still with us, make sure you reach out with questions as we go here. I apologize, I'm kind of moving my cursor around, but I want to keep an eye on the chat and the Q&A section as well. So the reset, reboot, and release phase. This is all about putting out the fire and trying to get the tissues, the joints, anything else back to a place where there's very limited guarding, very minimal tension, very minimal knots or trigger points, okay? And so one of the strategies that we use here, which is very, very beneficial, is called dry needling. And I'm not going to demonstrate dry needling on myself, but we are going to talk about it a little bit. And really what dry needling is, if you haven't heard about it yet, it's a way for us to use a very small acupuncture-like needle to go deep into the tissues and basically reboot them, reset them. And there's a couple positives that come with it. One, we control the thing that controls the muscles, which is the nerves, right? We alter the nervous activity in a positive way so that the things that control the muscles are not dysfunctional. Two, we bring some circulation to the muscles and the tissues. Three, we bring the muscle tension. If the muscle fibers are like this, we take it back to a far more normal spot, a far more normal length tension. And lastly, we produce an immune response. And what that means is it's like sending the troops to the area. So with that immune response, we send the troops to the area, and it does all the good things that an immune response is going to do, which is promote healing, promote cellular regeneration, all these different things. We might try manipulation. So spinal manipulation is a huge, huge part of our practice. And all it is it's a way to jumpstart the process, right? When we use spinal manipulation, which is if you've had a chiropractic adjustment, very similar, maybe different methodology, different theories, but we use spinal manipulation in this practice. And what we do is we produce a quick stretch and sometimes kind of a pop or a movement, a quick movement through the joints to produce fluid exchange and to produce relaxation of those muscles. We do massage, right? We do deep tissue work. We do soft tissue release. We do cupping here. We do myofascial cupping. And then this reset, reboot phase, we're probably going to take an individual through some assisted, some guided range of motion, and some stretching. It's really about getting the tissue not guarded, not frustrated, not frustrated by the tissue being guarded, not all knotted up, and start to improve some movement and some range of motion.